So the first layer is I have to cut through the scalp. This is the bloody part of the surgery because the scalp has a lot of blood flow to it. There's a lot of bleeding. We actually put little clips on the edge of the scalp to stop the bleeding. Then I reflect the scalp back, and then often we have to go through the chewing muscle. So I have to cut through that muscle, which can also be bloody, and then use little hooks to pull that muscle back to expose the underlying skull. And then once I'm looking at the skull, we use a drill and a special instrument to actually saw through the skull or cut through the skull and then remove that piece of bone. Once that piece of bone is removed, then I'm looking at the covering of the brain, and using a little fine knife and tweezers, I cut through the covering of the brain, being very careful not to injure the underlying brain or blood vessels, and then I reflect that covering off of the brain. And then finally, I'm looking at the brain, and then I can move on to resect the brain tumor or whatever abnormality that I'm going to be working on in the person's brain. So there's definitely multiple steps that you have to go through before you actually get to the brain. You don't just make an incision and you're there.